Hi guys, how's everybody doing? Egg freezing live with Dr. Keshav. And how do I pin this comment? And it's done. Hello, hi everyone. Okay, I'm just gonna take a quick second to close my bedroom door because I don't want to bother my entire family with my live. So I'll just be back in a second. Oh no, sorry. Hi Dr. Keshav, do you need me to send you a request? Sorry, I need to do this off camera, but I didn't have the time because I fell asleep, so I think I look a little bit more alive. Hi!
Hi, how are you?
I'm well, how are you doing?
All well. It's been such a long time.
It has been a very long time. I think I last saw you at the conference in January. No, in
March.
March, Hyderabad.
But
Yes.
we didn't meet there, right?
Very briefly, in front of that giant IVF wall thingy.
Yeah.
I think I was chatting with your mom for longer than I saw you. Okay,
Awesome.
do you want to give a quick introduction of yourself to everybody that's here so they know what you're going to be talking about, and then we can get on with a very general introduction of what we're going to be talking about.
Okay. So, hi everyone, and I can see there are quite a lot of people. This is probably a bigger audience than what I usually have at conferences. So, thank you, Tanaya, for this platform. I'm Dr. Keshav Malhotra. I'm actually a embryologist, or what you would call as a reproductive biologist. So basically, in simple terms, I make babies for a living. And that's probably the best line that most of us embryologists actually use. Is the worst pickup line, to be honest. But yeah, so I actually make babies for a living and do a lot of activities inside the laboratory pertaining to reproductive health, reproductive biology, women's health, men's health, all of those things. And it's mainly in the fertility aspect of or the fertility domain. So that's pretty much it. We both have the same background in the sense that we've done our MBBS and then we've forayed into embryology, and but now we are in different fields.
Yes,
Yeah,
quite
very,
different fields.
very different fields.
You were one of my inspirations when I started thinking of doing, should I do embryology, should I not do embryology? And oh wow, there's a lot. Your dad's here. Hello, uncle.
Ayo.
So, funnily enough, I did mention this when I posted the story about this. I've trained under Dr. Keshav, and today we're here to talk about egg freezing, and this is something that I haven't seen a lot happen in India. And Dr. Keshav is, hello, uncle. Sorry, Dr. Keshav is one of the few people who I know who does it, and I know who does it well. So I thought that, because there's so many questions that people have about egg freezing ever since I talked about it. One of my friends who's another embryologist recently got her eggs frozen. And, I thought that it would be a great idea if we could take some questions from people. And hello,
Mom's
Auntie.
also there. So whole family is there.
Is ma'am also here, your sister?
I can see mom there. I don't know if my sister is.
Lovely to see
Yeah.
everybody. So,
Yeah.
I thought we can take on some questions and find out what happens. So,
Yeah.
one of the most sort of common questions that I get about egg freezing is that what is it like? What happens in egg freezing? Who can get it done? What exactly happens here?
So that's a fairly basic question. If you talk about like the name suggests, egg freezing is just taking the eggs out and freezing them. So in order to actually preserve them for future use. Now we know that there are a lot of women who actually want to take control of their fertility, which is a fantastic thing. And the options for them were very limited before, like, let's say 2008, when this technology actually became, it came out from the research aspect, it came out from that experimental group, but now it's very commonly used. So basically what you do here is like any IVF process, the woman has to undergo stimulation. So by when I talk about stimulation, what we basically mean is that we give a few shots, we give a few injections to the woman just to stimulate the ovaries to produce more eggs. Uh, if I go back to biology, a woman is programmed to produce only one egg at a time, but when we're doing egg freezing, we want multiple eggs. We want like 15, 18, 20, whatever. So we stimulate the lady to produce more eggs, and then by an ultrasound and a needle, we just find the ovaries, poke the ovaries with the needle, take out those eggs. Then it's the job of the embryologist to see whether those eggs are good or not, and just dip them into like liquid nitrogen. So that's nowadays.
I'm not sure if this is my video that's frozen or yours. Huh.
Am I Hi.
Oops. Am I frozen? What's happening?
Okay. Should I
Am I
go ahead?
back on? Oh, it says both are frozen. Dear God. Yes, I think so. Am I visible now?
Yes.
Excellent.
So
Yes.
yeah. So we were right on the topic of egg freezing and our screens freeze. So
Very topical.
yeah. So so I was just saying that it's a fairly simple process where it's just like any other IVF cycle, but instead of creating embryos, we're just freezing the eggs, and it acts like an insurance policy. Though I don't like that term, and maybe we can discuss about it a little later. But it acts like an insurance policy for the woman to delay the pregnancy, delay like her marriage, etc., etc., and focus more on like work, on her career, etc., etc. So that's the basic technology.
Excellent. So that gives us a very good idea on how this happens. But who are the ideal people for doing this? So, can I go get my eggs frozen? I'm 27. I'm not thinking of a child right now. Am I a good candidate? How do you decide who's a good candidate?
Okay, that's a very good question, and like you mentioned, age is a very important aspect as far as selecting the right candidate for egg freezing is concerned. I think we're frozen again.
Oh, it seems to work for me. I mean, I can see you pretty clearly. Am I frozen?
Okay, yeah. So
Okay.
age is a very important aspect as far as deciding the right candidate for egg freezing is concerned. And it's basically said that you should be getting, if you're thinking about delaying your pregnancy, which I'm sure a lot of women would have that idea right in their heads around 25 or 26, where they would know that I want to focus on my career, I want to do other things before actually having a child. So you probably know about this way earlier than you would probably expect women to know about this from. And so late 20s, diverse population, they suffer from like early menopause, premature ovarian failure, and these are all very scary terms. So it's always beneficial to a gynecologist, talk to specialists. Very easy tests, blood tests can actually give us a lot of information, like just doing an AMH panel will give us a lot of information of what kind of a reserve you have, and that'll actually help us in determining whether you're a suitable candidate for egg freezing or not. But another point that I want to bring up here is that even if you're above, let's say, because I've had patients who were 40, 42 when they came for egg freezing, and we still got 8 or 10 eggs from them. Yeah, which is very rare. But then you have to explain to the patient that after 35, the quality of the egg really goes down. And the chances of having genetically abnormal children from it, the chances of all these common syndromes that you hear of, like Down syndrome, etc., these are very common. So we probably need genetic testing if you are going to use those eggs later on. So that's also something that people should know.
So quick question on adding to what you just spoke about. Could you tell us a little bit about what the AMH is and what it means, and what's a healthy AMH?
So AMH is basically a hormonal assay. It's something that the ovaries produce. It's a hormone that the ovaries produce or the follicles produce. So like if you look at the ovary, there are a lot of follicles which are there inside. So if you have a normal AMH, that generally tells us that your ovary is producing follicles, and it's a good way of actually assessing the fertility potential that you would have later on. Another way to like replace this would be to get an ultrasound done, and a common term that doctors use here would be an AFC, which is basically an antral follicular count. So that basically tells us, or it gives us a visual description of the number of follicles that are there in that particular menstrual cycle. So this is a blood test. Normal values are, I think, if you are more than 2.5, it should be normal. But again, anywhere less than 1 is where I would be worried. And if you've not really conceived, then I would be worried, and I'll like fast track that process of conception.
Okay, so jumping on to the same thought, is the fertility cliff real? Would you encourage people to have children earlier? Would you encourage people to freeze their eggs and freeze their sperm? Actually, no, let's focus on the egg right now.
Okay, so yes, the curve is real, and it's not just the decline in fertility that we are worried about. It's also like the quality of the gametes that goes down with age, because you might have a good reserve after 35. There could be people who would have a good reserve, but again, the DNA completely goes for a toss after the age of 35. So we have to counsel, we have to make people aware of the fact that 35 should be a cutoff age limit, at least for your first child. And it's not the case that it's not possible afterwards, but the chances of having abnormalities become more common after the age of 35. So that's something that people should know about.
Absolutely, that's very
And
well
even
said.
is there even for men? Obviously, this is not the time to discuss about men, but it's there even for men. And I think 40 is the limit for having good DNA within the sperm.
Excellently put. Oh, your sister's also here. Hi. So yeah, on the same thought, a lot of people are concerned. Like I'm seeing in the comment section, a lot of people are asking, what is the kind of cost involved in here? Is it affordable for an average person? And what is the success rates like? How often does this work?
Okay, so that's a fantastic question. Obviously, I'm sure people would know about the costs that are involved in IVF. The costs do vary from center to center. It varies from city to city. It also varies from like chain to chain, because there are so many IVF chains which are there in the country. So if I give you like a fair estimate, it should be costing anywhere between like 1.25 to 1.5 lakhs. Uh, and this is just a one-time cost for one cycle. There might be women who require more than one cycle. Like I can share some information with you. Like I have a patient at the moment, like today only I froze her eggs, and she's 33 and she only produces with the best of stimulation protocols, she only produces 2 eggs at a time. So for such a patient, it would require, let's say, 4 or even 5 cycles of stimulation. So the cost really depends on the kind of reserve that the woman has, and that's where your fertility consultant would help you out, and that's where early, like getting the process done early on is more beneficial, and it'll actually help you in limiting the costs in a much better fashion. Now, apart from this, costs also involve maintenance, because let's say you're 25, or let's say you're 27 and you freeze your eggs today, then you would want to use them after 6 years or 7 years when let's say you're 35. So maintaining those eggs in liquid nitrogen also costs money, and it's about 15 to 30,000 depending on the city that you live in per year as maintenance.
So it is a fair cost.
Yes,
And
it is. And
so
and
like
when and you
sorry.
asked another question there. what are the success rates, etc. with this thing. So we have to understand that this, and this is where I mentioned that it's not an insurance policy, because success rates vary. There's this very funny quote in our IVF community that a bad egg looks exactly the same as a good egg, right? And we can't really determine about the genetics of the egg. We can't really say whether the eggs that we're freezing are of good quality or would result in good embryos. So that's something that people need to understand. So when we say that this is an insurance policy, this means that whenever you get married, the first thing that you will want to do is to try for a natural conception and look at those timelines, try for a year at least, and then only think of using the eggs that you've reserved, and like take into consideration that the success rates with egg freezing is around 50%.
Is around 50%. Okay, so
Yes.
this is quite an investment, and we don't have 100%
It's,
guaranteed results from
yeah.
it. So it's not for everyone then, for sure.
I wouldn't say that it's not for everyone. It's something that, like especially women who are wanting to delay pregnancy, it's something that they should really consider, because it's much better than having a Downs baby. It's much better than having a genetically abnormal child. It's much better than having miscarriages, etc., etc. So there's a whole list of things that can happen, and I don't want to scare the audience here, but so it's something that every woman who's wanting to delay conception should consider, talk to a specialist, and then decide whether it's for them or not.
That's fair. And I think that's a very good advice in general for, medical things
Yeah, for any
anyway.
medical procedure, yeah.
Absolutely. So, you're talking about how the egg quality sort of starts degrading as you grow older. So, are there any tests one can get done to see, like you said, a good quality egg looks exactly like a bad quality egg.
Yeah.
So, can somebody get any tests done to see if their eggs are healthy or not?
Not really. The only way that we could think of like checking the quality is by injecting a sperm into it, and like pray whether it results in an embryo or a blastocyst, and hope that it implants. But probably that's not what women want when they're freezing their eggs at that point. So not really. But obviously there are things like other metabolic conditions. If you are obese, if you are suffering from diabetes, if you have thyroid issues, these are all things that tell us that the eggs might not be as good as a normal patient would have. So, like, these are also things that should be considered.
And going along the same line, what are the things one can do to make sure their eggs are healthy?
So, that's again a very good question. Now, there are, if you Google how can I keep my eggs healthy, obviously there will be some articles on it. If you Google how can I keep my sperms healthy, there'll be like a plethora of articles, and like a plethora of Ayurvedic and homeopathic solutions for it. But when we're talking about eggs, having a healthy diet is something that is very, very important. Having antioxidants is also something that's gaining a lot of like there's a lot of research which is happening talking about let's a very common antioxidant like coenzyme Q, which is very easily available. Like people might know CoQ10. So these are the things that women can take. There's also things like DHEA. There are things like very like even like testosterone, etc. There's certain things that can be given to the woman, but obviously all of these have to be prescribed by a doctor, except for the diet, and that's something again that you should consult a physician or a fertility specialist before you start taking them like left, right, and center.
Absolutely. And I found a really nice question in the comments, which is that what do you mean when you say delay? So, like, up to what age is delaying a pregnancy? How late is late, essentially?
So, again, there are so many people who conceive after the age of 40, which I would say are outliers in the graph that we have. If I want to point out on an age, especially for our Indian population, it is 35. So at least your first child should be conceived before the age of 35. After that, maybe you can try for a second child. A lot of people do conceive um, naturally even after 35, but your chances of conception go down, your chances of having a normal child go down after the age of 35, and even your partner might age. So, like, those factors also need to be considered at this point. So, you might have a partner who will be over 40 at that point. And those factors, again, also have to be thought about because it's not, you're not the only one who's responsible for that child or responsible for producing that child. It's a 50-50 contribution from both the sides. So that's why I said like 35 is probably the age that you should be looking at before having before 35 have your first child. And this is for natural conception.
Mhm. So my mom had me when she was 40. So, I mean, yes, of course, they're outliers,
Yeah,
but I was a budhape ki child. But not everybody should rely on that.
that's true.
There's another question that I found really interesting that two people have asked, and I think one of them was a doctor. I think I recognize his name, but I'm not sure if I'm correct. The question is that what happens to these frozen eggs? Like, what do you do with them? Do you have to have an IVF pregnancy? Can you put them back inside a person? What happens?
That's a fantastic question. So whenever we're taking these eggs out, we're freezing them. They're frozen in liquid nitrogen. Liquid nitrogen is at minus 196 degrees. So it's
Wow.
minus 196 below zero. Very, very cold. If I put my finger in liquid nitrogen, it'll just freeze instantly and drop off in the same tank. So never do that. So they're kept inside that tank for however long you want. And once you are ready to conceive, ICSI is the process of choice for fertilizing these eggs. Then we form embryos out of these eggs within the laboratory. And then you put in one or two embryos back into the patient, depending on the number of embryos that you have and the quality of embryos that you have.
So IVF ICSI is the way to go. But
Is
just
the
for the
only, yeah.
audience, could we talk about what ICSI is?
Okay, so let's differentiate between IVF and ICSI. So I'll talk about IVF first. IVF is basically a process where you take out the egg, you get the sperms in, and then you just put a few drops of the sperm sample, obviously after preparing, into the same dish which contains the egg. So the sperms are actually allowed to do their own job, fertilize, like the best sperm would go and stick to the egg and fertilize the egg in a more like natural way, if I might say. With ICSI, what's happening is that it's the job of the embryologist to select the best sperm and then inject it directly into the egg. Right. So whenever we're freezing eggs, what's happening is that we remove the outer cells which cover the egg, which are very much important for IVF. So once we've removed those cells, it would not really have the same kind of fertilization rates with IVF, and that's why ICSI is something that's preferred. Another thing that happens is that once you freeze the eggs, the outer layer of the eggs becomes hard. So you need that needle to pierce into the egg in order to deliver the sperm inside the egg. So that's the basic process.
Excellent. There's another question. My mom is also here. What do you do with the abandoned eggs?
Okay, very good question. Now, there is so much research uh, nowadays which says that so many women who actually get their eggs frozen never really come back to the IVF unit to like conceive, because most of these women would conceive naturally, right? So, like I mentioned earlier, this is just like an insurance policy which you have where these eggs will be only used if you're not able to conceive naturally once you get married.
Mm-hmm.
But again, when you talk about what do you do with these abandoned eggs, we have to keep them. If the patient is regularly paying the maintenance cost, then the clinic is obliged to keep them. And we keep them for about 7 to 10 years based on our guidelines. Um, if someone wants to actually store them for more than 10 years, we actually just send a letter to ICMR, which is our regulatory authority, that we're going to store them, and that's pretty much it. So we can store them for more than 10 years, we can store them for less than 10 years, and most of the times we are really obliged to keep them for those 7 to 10 years, because we never know that when the patient would change their mind, or when, even if they've conceived for the first time, they might want a second child, they might want a third child, etc. So many things, so many possibilities here. So you would want to keep them for about 7 years.
This is actually quite similar to what it is in the UK. I'm a little bit more well versed with the law
Yeah.
situation over there. So with the HFEA, which is the Human Fertilization and Embryo Authority, something like that.
Yeah.
They have this stipulation that you can't keep them for more than 10 years.
Yeah.
And are the Indian guidelines based on similar guidelines, or is there something of that sort?
There are no so there's no law as per in India. It's not as strict as HFEA.
I think you guys are the ones who came up with the ART guidelines in one of the conferences, right?
So we did work upon creating some sort of practice guidelines for people to follow, and it does mention the same 7 to 10 years. And what's mentioned in the ICMR guidelines is 7 years for embryo freezing. So we tend to follow the same for oocytes as well.
Mm-hmm. Excellent. I just found a bunch of questions as well that I have lost. Can I still use my frozen eggs in the future even without trying for a natural pregnancy?
Yes, obviously. So if you feel like
I need to take off for 1 second. I think the bell has just rang and I'm alone over here. So have your moment. Just talk a little bit. I'll be back in a second.
So if you are thinking of using your eggs later on, and if you're not trying for a natural pregnancy, this is obviously a very good option for you. You obviously need a partner. In some instances, you don't even need a partner because in India, the law says that single women can still have children. So you can actually get a partner or a sample from a donor bank, and those embryos can be created and can be implanted. So even if you're single, if you're not married yet, but you're thinking of actually having a child, then this is again a very good aspect that you should be thinking about. Okay, so there's another question. I'll take the privilege of just asking the questions myself. How does the Indian law holds the governance of these genetic materials? So we're talking about the Indian law. Okay, so in India there is this regulatory body which is known as ICMR, which is the Indian Council of Medical Research, and that really governs most of the technologies per se. I'm answering the next question now.
Oh, yes, of course.
So it's the ICMR which governs us. If I look at the current update, there is this ART bill, which I'm sure some of you must have heard of if you've tuned into the news. So that's something that has been passed in the Lok Sabha. It's still not passed in the Rajya Sabha. And if the winter session comes into play, which it might not, we might get some updates on whether it's going to be passed as a law or not. But till then, it's the ICMR which actually governs us, and it's mainly self-regulation and not being regulated by the government at this current point.
Which is great, actually. Less interference because they make laws without being educated about it, particularly in our field.
Absolutely. And they don't even listen to the feedback that's given to them. It's a challenge.
Particularly with the surrogacy bill and everything that went down with it, I was just like, why? Why?
Yeah.
Listen to the experts.
Absolutely. So we were just discussing. Yeah.
Sorry.
No, we were just discussing options for single women, and if they don't find partners, then it's still allowed for them to actually use donor sperm and use samples from the bank and conceive. So even if you're freezing your eggs, that's also another option that you can think of.
That's great, actually. Yeah, very, very significant in this day and age when so many people are choosing to become single parents, and I think it's a wonderful initiative. There's another question that I keep seeing and I miss taking up. Can we have a normal pregnancy?
Okay, I lost you there. Can we have a normal? Can you repeat the question,
sorry,
please?
yes. So the can you have a pregnancy with tissue that has been, ovarian tissue that has been cryopreserved instead of eggs? And if you could explain a little bit about what that is as well.
Okay, so this is a fantastic question. I'm so glad that this question is being deliberated upon here. So ovarian tissue cryopreservation is something that is getting a lot of awareness nowadays, especially for women who have cancer. So because whenever we give like chemotherapy or whenever we give radiotherapy to any cancer patient, what it does is that it completely kills off all the reproductive cells that are there within the body. So whether it's a man or a woman, they would lose out on eggs and sperm, and this would not really recover. So what is being advised here is that before such women go in for chemo or radiotherapy, they should get either their eggs frozen, which is not possible because they don't have time. As soon as you get a diagnosis of cancer, you would want to actually start chemotherapy from the next day because you want to be like, do whatever. I just want to get rid of cancer. So it's something that is not common for cancer patients. So what can be done is that laparoscopically, you can take out chunks of the ovary and you can vitrify or you can freeze those chunks. And once the chemotherapy is over and once the radiotherapy is over and the woman is cancer free, like to the ovarian fossa, and these women can actually have natural pregnancies. So you would not even require IVF later on. You can actually conceive naturally with the chunk of tissue that's put back in. But obviously there are other things to worry about. We might reintroduce cancer.
Absolutely. Actually, after I finished my master's, this is what we were working on. So Oxford had a research center where they were working on ovarian tissue and testicular tissue preservation in prepubescent children. So, very young children who haven't even achieved puberty yet, and they have a cancer diagnosis. So it was a very difficult sort of sector of work. And they used to freeze their tissue from the testicle or, the entire ovary. And in this sort of cryopreservation, they've had a few pregnancies, successful pregnancies across the world. So that was very, very motivating. And I think it's a wonderful thing to, that we're researching upon and sort of taking care of these days.
Yeah. There are a lot of live births which have happened with ovarian tissue cryopreservation, especially in countries like Japan and like UK, etc. There are so many births which have happened. And the best part about this technology is that, like you mentioned, it can be done in prepubertal women. For boys, it's difficult because uh,
Yeah,
the number of eggs that you have is predetermined before you're even born. You actually have more eggs when you're a fetus than when you're a living human being, and this completely goes on declining. And these tissue part pieces can be cryopreserved at whatever age that you want, especially for a girl. But for boys, it actually has to be after puberty. So that's a major advantage which can be offered to cancer patients, especially girls.
absolutely. There was another question that I thought was very interesting. That's from my friend called Tanya. And she's asking, how do the doctors decide which sperm? I can't find the question. How do the
Which sperm to
doctors
use?
decide which sperm should be using, essentially?
Yeah, so that's
Used.
that's that's a very common question. That's a common question that a lot of people ask, and it's not the doctor that decides, it's the embryologist that decides. I want to specify that because embryologists don't get any credit, so I would like
Represent.
represent them as much as possible. So what we do is that we look at it under the microscope. It's at very high magnification. It's at 400 times what you would actually see with your normal eyes. And at such high magnification, what you will see is that you'll see the morphology of the sperm. You'll see how it's looking. So the best looking sperm probably wins this competition. But again, it's not the best way of selecting sperms. And maybe if we do a session on sperms and everything about sperms, we can talk about all the other factors that should be considered when we're selecting sperms and putting them in. But till then, it's the best looking ones.
Excellent. Okay, so I'm going to take one more question from the audience before we before my voice goes out. And the question here that I really liked, and please choose if you want any questions to take up and if there's anything you'd like to talk about. Is there any risk of predisposition of any disorders in the fetus that comes in from a pregnancy that comes from cryopreserved eggs?
Okay, so to answer that question, maybe we don't know yet. Like I mentioned, this technology only became a routine procedure in 2008 and after 2008, and we still don't have enough evidence to suggest whether this is something that can happen. And most of these developmental disorders do start to creep up like post like 5, 6, 10 years, and we've not had that much time to evaluate. So I'll leave that question as a maybe, but we have to understand that even with regular IVF, there is a 1% chance, or there is like 1.5 or 2% chance that you might have some sort of genetic disorder. Uh, I also consider the fact that autism is something that could be another disorder which could be associated with IVF. But whenever it's been researched, it's always been that there are more factors to it. It's not just the process itself, it's mainly your biology, which is actually affecting all of these disorders. So we can't really blame biology for it, but we have to be aware that this is a possibility.
Absolutely. And like with all technologies, there come issues that we haven't explored yet. But this technology has been so helpful for so many people, particularly for people with a cancer diagnosis, which is such a difficult thing in itself. And then, they can fulfill their dream of having a biological child.
Yeah.
Yeah, so see if there are any questions that you find interesting that I may have missed, because
Yeah, I'm
you've
just
come at such a
looking
quick
at them.
rate.
Yeah, I'm just looking at them. I think a lot of people are still asking about the age because I think there'll be new people who joining in. So before 35, please, that's the age that you should be targeting. Uh, there's a question which says that can you determine the looking at it? No, you can't do that. And like in the Western world, there are genetic tests that can be done, but in our country, it's not allowed. And there's no difference between a girl and a boy. So please get that out of your heads. And again, there's chances people talking about abortions. It's the same possibility as a normal IVF pregnancy. Worry about it. Even better pregnancies as compared to natural cycles. So that's also something that you should know about. And yeah, what's the minimum number of eggs? That's a good question. I think we should take that and we can probably sum it up. So it's been said that you should have at least 15 eggs frozen for one good try. And this is on an average. So when I say 15 eggs, what I mean is that out of those 15, let's say if we talk about a 90% survival rate, which is common in the country, there are clinics who get more than 90, but if we talk about an average survival, 90%, we've already lost on 2 or 3 eggs, so you're left with about 12, and out of those 12, the quality is not something that we mind. So 15 eggs for one good try. I would say 20 eggs for like 2 tries or two good attempts. And again, do take into consideration that the success rate is about 50, maximum to about 60% with any in vitro fertilization process.
Excellent. Oops, I think the connection's playing up again. Oh, excellent. That was extremely insightful, and thank you so much for taking up and answering these questions in such a simple manner and, helping everybody with all of their questions. Guys, if you have more questions, feel free to, I'm saying this on your behalf, is it? Should they feel free to DM you?
Why not? I'll be happy to, as long as it's not
So
like free consultations. I'll be happy to like address them. I hope I don't get
Believe me,
flooded with the
you're going to
kind
get
of
a lot of requests to say consult.
I hope I don't get flooded with the kind of content that you get flooded with. So that's something that I don't want.
Oh gosh. I think you'll be all right. Thank you so much for chatting with me and answering all of these questions. And maybe we'll do another one and talk about sperms the next time.
Awesome. It was such a pleasure.
Alrighty. Bye. Good night.
Bye, guys, and do like worry about your fertility. That's something that uh, you have to. It's only you or your mothers who will think about it, nobody else. So please consult a consult a gynecologist at the right time, and I think that's something that all women should actually be following. Awesome.
Just for everybody else, that this live will be saved on my IGTV, so you can see it there. And Dr. Keshav, I'll send it over to you as well, so you can share it.
Awesome.
Bye.
Bye.